In Coshocton, in Canton, in Ohio, in US in general, we really do a good job in treating medical conditions, treating disease processes, preventing complications and stuff. But what we really don't focus or don't do well is maybe in other advanced countries is about prevention, about how to maintain health, how to prevent patients getting into the disease conditions, prevent patients from getting sick in the first place. That focus is not there, maybe because the way our healthcare system is set up. But I think it's very important for the patients to focus on that, because at the end of the day, an ounce of prevention is worth a pound of cure. So in my opinion, the two main things I think patients should focus on: lifestyle and diet. I mean, I think a lot has been said about this, but I think there's a lot more to be said about this as well. This is an evolving thing. We've talked about exercise for probably several decades, and we still are fine-tuning what should be the exact recommendation. But I think it's more important, rather than going to one particular exercise regimen, patients to focus on what they can sustain in the long term. We see a lot of patients getting into certain workouts, which they may be able to do it for weeks or months, but probably not be able to sustain for years or decades. So try to work into a regimen which you can sustain in the long run. Maybe you can do something for the short term to get into the groove, but it's important to focus on something you can do and sustain in the long term. You don't necessarily have to do 30 minutes or an hour of exercise at a stretch every day. Maybe walk fast at your workplace. Maybe when you have a lunch break, have a 10-minute power walk, and maybe you can do some lunges. Maybe you can do some stretches at work to kind of break the monotony. That does help you stay in shape and probably make you help break the monotony of work. So kind of do what you can do in the long term. Now, as far as diet is concerned, we've gone 180 or probably 360 on this. Moderation is probably the watchword. I generally don't recommend patients to go for any extreme diets because what may be in fashion today may be proven wrong like 5 years down the line, 10 years down the line. Maybe it's okay to start a diet, to lose weight, to get started, but it's very important that you get yourself into a dietary regimen which you can sustain in the long term. The third thing that I think we want to focus is sleep. So a lot of patients don't recognize the importance of sleep, and we find sleep apnea as something that's significantly underdiagnosed and undertreated even after the diagnosis. A lot of patients don't realize that they have sleep apnea. They don't realize they're snoring. It's the people in the household who are going to be saying if they're snoring or not. So I've seen a lot of patients kind of vouch that they don't have sleep apnea, they don't snore, just to see that the person who accompanied them say that no, you snore a lot. So it's important to recognize the value of sleep in maintaining our health. And if you have any concerns about sleep apnea, make sure you talk to your providers. They will be able to help you with that. And weight loss is an important tool in treating sleep apnea. A lot of patients who are borderline patients in sleep apnea, when they lose weight, their sleep apnea gets better. So sleep hygiene is another important thing. A lot of patients take gadgets to the bed, and they are browsing their social media messages right before they go to sleep. The bright light is not really good when you're right about to fall asleep. So though you may be spending 8 hours in the bed, you may not be getting good 8 hours of quality of sleep. So make sure have a good sleep hygiene. And if you have any questions, talk to your provider. Whether your primary care providers are an excellent resource for this. And if you have any medical conditions, obviously you need to talk to your providers. A lot of times patients feel when they get better, they don't need to take their medications as they're prescribed. That's a very important thing that patients should pay attention to. A lot of these medications that are prescribed are not for short term, but they're for maintenance of well-being. So if you ever have any problem with any particular medication, or if you feel you don't need to take it anymore, discuss with your provider before you stop them. A lot of medications could have what we have withdrawal effects. Blood pressure medication which a patient has been taking for several months or several years, when they abruptly stop it, the blood pressure could skyrocket, and that could land a patient in the ER and could cause a life-threatening complication. So it's important that you maintain regular follow-up with your doctors, listen to their recommendations, and comply with the treatment regimen. So that's good. Yeah, I think this should be more than enough, maybe for 5 minutes. Okay, yeah, you may have to slow it down. I tend to talk fast, so.